Today, the topic for today's discussion is gastritis and gastric ulcers. Okay, so we would like to know what exactly gastritis and gastric ulcers are. So we might have everybody in our day-to-day lives, we might have come across the word. So I would like to explain you people in detail what exactly gastritis means. Okay, so various patients describe in their own manner. So it may be chest discomfort, chest pain, chest burning sensation, vomiting sensation, stomach pain, back pain, and a number of things. So multiple things all can mimic gastritis. Okay, so the most importantly, whenever the patient having a chest pain, the first thing what we do is take an ECG. Once the ECG is normal, so we have something else to blame. That may be one of the predominant causes of gastritis. Okay, so why does this gastritis occurs? Why do you feel burning sensation in the chest? It may be due to multiple factors that we come across on a daily basis that is modifiable, such as smoking, alcohol intake, excessive caffeine intake, lifestyle changes, that is skipping meals, avoiding meals, having meal at a bizarre late night beyond 12 o'clock. All these things can lead to gastritis symptoms, that is retrosternal burning sensation, stomach pain, vomiting, altered bowel habits, and a number of things it can lead to. Okay, so there are multiple risk factors that is we can possibly avoid gastritis. Okay, so how to deal with gastritis on a daily basis? So what can you do and when you need to see a doctor? Okay, gastritis is not something it can be curable maybe in say 1 week or 2 weeks, but by taking PPIs, that is pantoprazole, esomeprazole, and any other tablets. But if it is not resolved in a span of 7 days, 10 days, 15 days, say maybe, so this is not supposed to be overlooked at. Okay, most of the patients presume that these things will subside on its own. Okay, it does not. If the symptoms has not subsided at the end of 7 days, end of 10 days, definitely you need to see a doctor. Okay, why you need to see a doctor? There may be multiple reasons for your gastritis, which is not simple all the time. It may be sometimes complex also. How complex, what gastritis can lead to if it is not treated? Okay, gastritis can lead to gastric ulcerations also. Okay, before leading to gastric ulcers, so first let me tell you why gastritis occurs. Gastritis, see, our stomach has good bacteria and bad bacteria both. All the bacteria has to be always in balance. Once there is imbalance between these two bacteria, the growth of bad bacteria, we generally call it H. pylori infection. The presence of this bacteria can cause excessive gastritis symptoms. It can cause abdominal bloating sensations, vomiting sensation, discomfort, uneasiness, early satiety. That means you have small quantity of food and you don't feel like eating further. Okay, all these symptoms can occur when there is H. pylori infection present. Secondly, there may be presence of ulcerations. Ulcers. How do these ulcers occur? So chronic gastritis, when gastritis is not treated for a longer time, the acidity inside the stomach, okay, the acid content increases and it can cause ulcerations. Just like how we have mouth ulcers present just below our lips, the similar ulcers can happen inside the stomach also, which can go unnoticed and can have deadly consequences if it is not treated. Okay, so ulcers are very important and it is better to be early diagnosed and treated than late. Okay, thirdly, coming to the anatomy of the esophagus or the food pipe, whatever we call. So there may be laxity of the lower esophageal sphincter. Whenever we have food, our food digests, it goes from above to below. It does not come from below to above. So why it does not come below to above? There is a valve, that is the lower esophageal sphincter, which has to be working in adequate, timely manner. If this sphincter is not working in a timely manner, so then the patient has recurrent gastritis symptoms. Okay, whatever the acid content or the food content present inside the stomach can regurgitate upwards. Okay, it can cause vomiting sensation, burning sensation again. Okay, so this can also be corrected. Okay, lastly, there can be rare things like tumor, mass, or any growth which may be accidentally found. We have found in many patients who have been ignoring gastritis or stomach pain symptoms for a long duration, and ultrasound most of the time appears normal. So the patient thinks that he has nothing else and he thinks it is only gastritis, and he avoids further investigations and management. So this is something what I would like to create an awareness here. If there is symptoms have not resolved in 15 days, in 20 days, so definitely meet a gastroenterologist, and you might have to undergo a procedure called endoscopy. Okay, what is endoscopy? Why do we do it? So endoscopy is a thin, long, like an elongated pipe which is placed from your mouth all the way up to the first part of your small intestine, that is the duodenum. It evaluates your esophagus, it evaluates all the three parts of the stomach and the lower part, the first part of the small intestine. All these things are thoroughly looked at, and it is a simple procedure. It is an OPD procedure. It can be done in under 2 to 3 minutes. So having endoscopy done will give you multiple information about the laxity of the lower esophageal sphincter. Is there any presence of H. pylori infection or not? Is there any presence of any abnormalities like growth, mass, or any other abnormal tissues? It can be known, and also it can trigger the presence of good and the bad bacteria, like I already told you about the H. pylori infection. Okay, so all these things, evaluation can be done inside the stomach only for about 2 to 3 minutes having an endoscopy. If some patients find the procedure very uncomfortable, okay, it is definitely not comfortable. There is only minor amount of discomfort that is done to the procedure. It will just feel like something is going down your throat and nothing beyond that. Okay, it is only a simple procedure that we have done patients only for more than 90 years old also. We have done in patients less than 10 years old also. Okay, so most of my patients do not require sedation. Only maybe out of 50 patients, 2 patients might require sedation. That is, a small amount of sleeping medicine is given to you to tolerate that discomfort, who cannot tolerate any amount of discomfort. Okay, so this I would like to create awareness regarding the evaluation of gastritis, and not all gastritis is treated only with PPIs. Okay, there are so many other things that can be ruled, especially in the suburban population and the rural population. Patients tend to ignore the chronic smokers, chronic tobacco chewers, and drug abusers and all these things. Patients come across with various vague symptoms. After about years together, they land up with big adenocarcinomas, squamous cell carcinomas, Barrett's esophagus. All these things can occur on a later stage, which may not be completely curable. So a timely manner of this procedures and awareness will definitely help us in beating these cancerous diseases on a later basis. Okay, so how do we avoid these gastritis on a daily basis? What you need to do as a common man? So definitely you need to have your meals on a timely manner. You should not skip your meals. So before 9 o'clock your breakfast has to be done, and 12:30, 1 o'clock your lunch, and a small snack maybe about 4 o'clock or 5 o'clock. Generally you can avoid biscuits or bread that only create more bloating sensation in the long run, and also your dinner by 8:30 maximum. Okay, you need to have at least about 1 hour of gap, minimum of 1 hour. Ideally we say 1.5 hours, but at least minimum of 1 hour before your bedtime and after your dinner time. So this time will definitely help you in digest the movement of the food from the stomach in the lower part of the small intestines. That is going to help you. So some people with lax lower esophageal sphincter, what happens? You lie down immediately after having food, and all the food contents from the stomach will slowly start ascending towards upwards, that is towards the esophagus, and cause irritation in the lower end of the esophagus. Lower end of the esophagus on a chronic basis, when it is irritated, it can cause esophagitis. Esophagitis, a repeated infection, can cause Barrett's esophagus. Barrett's esophagus is something cancerous. Okay, that can lead to. So you should not avoid these symptoms whatever you are facing. Sometimes asthmatics also have similar problems. They have burning sensation, all these things. So once the other evaluation is done, like you say cardiac evaluation by ECG, pulmonary evaluation by pulmonary function test, all these things are normal. So then you can go ahead with a gastroenterology opinion and evaluation also at the same time. So also definitely avoiding alcohol, smoking, soft drinks, aerated drinks, spicy food, oily food, all these things can lead to increased acidity again. Okay, definitely these things has to be avoided. So natural probiotics in our daily foods like curds and buttermilk are good for your stomach. Okay, and also those people who tend to have generally bloating sensation in the stomach, they can avoid wheat. Okay, not everybody should avoid wheat. Some people who tend to have bloating, can try and avoid wheat and see how they feel. If they are comfortable without the wheat, they can have less often wheat, and that's how the symptoms can come down. Okay, coming to vegetables, tomato is something which is very citrus in nature and can be avoided if the patient is having severe gastritis symptoms. And coming to fruits, orange and Mosambi is something that can be avoided if the patient is experiencing heavy gastritis symptoms. Okay, so apart from that, plenty of water, about 2 to 3 liters of water per day definitely has to be taken. So anything abnormal for more than 2 weeks, kindly remember, so you have to meet a gastroenterologist to evaluate further, especially in the elderly people who are reluctant to visit the hospital and are very scared of the procedure. So I would like to assure you that it is a very simple procedure. It is a daycare procedure which is done in only in 2 minutes. So we will have to rule out. Okay, there is something called colonoscopy also, which is on a routinely after the age of 50. For every 5 years it has to be done. Okay, this is very strictly followed in the US, but in India the awareness is still very minimal. So I would like to raise awareness about colon cancers as well. So it is incidentally we detect a lot of colon cancers, especially in the above the age of 55, above the age of 60. So incidentally, the patient has bleeding from rectal area, and he thinks it is piles, hemorrhoids, fissures, and he avoids coming to the hospital by treating it to a nearby hospital, treating it as hemorrhoids or fissures. So out of 10 patients, 1 patient in my clinical practice definitely has something beyond fissures or hemorrhoids. We have ulcerations, there is something called ulcerative colitis. There may be ulcers present inside the entire colon, that is the large intestine may also be filled with ulcers. That ulcers can also cause bleeding. And also there may be presence of any abnormal polyp, abnormal mass growth, which can turn to cancerous in a due course of time. So definitely one should not wait. If at all there is symptoms of bleed PR and it is the hemorrhoids or fissures are not looking something the major cause, definitely a patient should go ahead with a colonoscopy. Colonoscopy is a small tube that is put from below, that is from anus all the way, visualize the entire large bowel. Okay, so coming back to gastritis and gastric ulcers, this is what I would like to brief today and raise awareness. So I would like to have any doubts, if at all anybody has or anything, I would feel free to ask me. So I am available in Atreum Hospital, Nagar, Bangalore from 10 o'clock to 2 o'clock Monday to Saturday. So anything, any queries you have relating to gastroenterology, you can kindly ask me. I would be happy to share my knowledge with you.